My name is Wilhelm Hübner. I'm from Vienna. I'm professor for urology and I've been working in male incontinence for about 25 years, very much focused into this topic. I've been working internationally. I've been doing courses for the International Continence Society, basically a higher risk for incontinence after prostate surgeries, after radical prostatectomies. It used to be a high percentage in the era of open surgery. However, now basically using the robot and the new methods, the risk is much lower. However, at the end of the day, about 5% will probably still need some sort of therapy after radical prostatectomy. A man that loses urine is considered to be old, to be sick with his prostate, probably impotent. So the social implications are really hard. These men withdraw from social life, they don't do any sports anymore, and they may be severely depressed. In our incontinence center, we can basically treat all kinds of incontinence. Is it severe? Is it not so severe? Is it an older patient? Is it a younger patient? Has the surgery been done long time ago or just last year? We have all the possibilities to treat male incontinence, which are basically available in the world. The problem can be solved in the vast majority of cases, or it can at least be improved to a point where the patient comes back to social life. The key to a successful treatment is that it is tailored for the needs of the patient. It should not be determined by the repertoire of the surgeon. In that way, every patient gets the right therapy. The armamentarium that we have to treat male incontinence is wide. It goes from simple slings over adjustable slings, adjustable balloons, up to real sphincters with an open-close mechanism. The decision which method to use can be based upon the severity of the incontinence, but also on contraindications. Certain methods should not be used in certain patients, so then you use a different method. The operations to treat male incontinence are not very invasive. It starts with a balloon implantation that may take 10 to 15, maximum 20 minutes, and end with a sphincter implantation, which also takes only 45 minutes. The hospital stay will be maximum 2 days. It is important to state that incontinence after prostate surgery can be treated any time after. It makes sense to wait at least 6 months, but if then you're still very incontinent, something should be done. On the other hand, even 5 or 10 years after the surgery, maybe when the situation deteriorates, after a radiotherapy, for instance, you still can treat it. The most important part, for instance, for treatment of prostate cancer, of course, is the oncologic therapy. However, the good news is that even if a patient is under chemotherapy, you can do such a surgery between cycles because it is so minimally invasive. I think one of the big benefits here is that the patients are cared for individually. And of course, the biggest advantage is that we have the whole repertoire available. What really makes me happy in doing what I do is that we have the possibility to bring patients back to life.